If you or someone you love has been getting a little more forgetful lately, misplacing keys, forgetting names, walking into a room and having no idea why, you might think it's just normal aging. But what if I told you the real culprit isn't age at all? It might be sitting in your medicine cabinet right now. Doctors prescribe these medications every single day. They're considered safe. They're considered standard. But for millions of seniors, these pills are quietly, silently stealing their memory. And here's the scary part. Most people don't realize it until the damage is already done. By the end of this video, you're going to know exactly which 5 medications to look for, why they affect your brain, and, most importantly, what to say to your doctor to protect yourself or your loved ones. Because this isn't about stopping medication cold turkey. That's dangerous. This is about having the right conversation. Let's get started. Let me paint a picture for you. Imagine a 72-year-old man named Frank. Frank is sharp. He's a retired engineer. He can still do the New York Times crossword puzzle in 20 minutes. But about a year ago, Frank started forgetting things. He'd go to the grocery store and forget what he came for. He'd forget appointments. One day, he got lost driving to his daughter's house, a route he'd taken 100 times. His family panicked. They thought it was Alzheimer's. Frank was terrified. They went to the neurologist. They did the brain scans, the memory tests. The doctor said, "Well, it could be early dementia. Let's monitor it." But no one asked the simple question. What medications is Frank taking? Frank was on a blood pressure medication, a pill for bladder control, and an allergy medication. All 3 of those medications are on the list I'm about to share with you. Within 6 months of working with his primary care doctor to adjust those prescriptions, Frank's confusion cleared up. He wasn't losing his mind. He was having a reaction to his medicine. And this happens more often than you think. The National Institute on Aging actually calls these medication-induced cognitive impairment. But most of the time, it gets misdiagnosed as dementia. Today I'm going to show you how to avoid becoming a statistic. Let's start with the first culprit. This is the one I see causing the most problems, and most people have no idea it's even affecting their brain. I'm talking about anticholinergic drugs. Now don't let the big words scare you. Let's break it down simply. Your brain runs on chemical messengers called neurotransmitters. Think of them as little delivery trucks carrying messages between your brain cells. Acetylcholine is one of the most important messengers for memory, learning, and focus. It's the gas that runs your memory engine. Anticholinergic drugs do exactly what the name says. They block acetylcholine. They literally put up a roadblock so those memory messages can't get through. Now, what kind of medications fall into this category? Here's where it gets tricky. Over-the-counter sleep aids like diphenhydramine, that's the active ingredient in many PM pain relievers and sleep pills, brands like Tylenol PM, Advil PM, and simply sleep aid tablets. Also, many allergy medications. That same ingredient is in Benadryl. And here's the thing. For a younger person, the effect is mild. Maybe you feel a little groggy. But for a senior, the brain is already changing. The blood-brain barrier, which is like the filter that protects your brain, gets thinner as we age. More of that medication gets through, and it stays in the system longer because kidney function slows down. So what happens? Researchers at the University of Washington and the University of California studied this. They found that people over 65 who took anticholinergic medications for just a few months had brain scans that showed reduced brain size and lower metabolism in the areas responsible for memory. One study from the journal JAMA Neurology followed people for 10 years. The results were startling. People who took these drugs long-term had a 50% higher risk of developing dementia. 50%. Let that sink in. If you or a loved one uses an allergy pill every day during pollen season or a PM pain reliever to sleep at night, you need to know this. Now, I'm not saying you should never take them. If you have a severe allergic reaction, Benadryl is a lifesaver. But for daily use, there are alternatives. And we're going to talk about those at the end of the video. Now let's move to the second medication. This one is tricky because it's often prescribed for a very common issue that older adults deal with. We're talking about benzodiazepines. You might know them by their brand names: Xanax, Valium, Ativan, Klonopin. These are the calm-down pills. Doctors prescribe them for anxiety, panic attacks, and muscle spasms. And for years, they were also used as sleep aids. Here's how they work. Benzodiazepines enhance something called GABA in your brain. GABA is like the brake pedal of your nervous system. It slows things down. That sounds good, right? If you're anxious, you want to slow down. But here's the problem. When you press the brakes on your nervous system, you also press the brakes on your memory formation. These drugs affect the hippocampus, the part of your brain that's responsible for forming new memories. It's like a camera that takes pictures of your day. Benzodiazepines fog up the lens. I want to tell you about a study that came out of France. Researchers looked at thousands of people over the age of 65 who started taking benzodiazepines. They found that within just 5 years, the risk of dementia increased by 50%. Another study showed that even people who took these medications intermittently, just once in a while, still showed measurable cognitive decline. Now here's where it gets scary. These drugs are highly addictive. Even if you take them exactly as prescribed for a few weeks, your body becomes dependent. And when people try to stop, they often experience rebound anxiety, worse than before, and severe insomnia. So people get stuck. They think they need the pill to function, but the pill is slowly stealing their memory. I want you to listen carefully. If you or a loved one has been on Xanax or Valium for more than a few weeks, especially for sleep or daily anxiety, this is one you absolutely need to ask your doctor about. Because there are safer ways to manage anxiety and insomnia, especially when we look at non-drug approaches. We'll get to those solutions soon. Let's go to the third category. This one is surprising to a lot of people because it has nothing to do with your brain, or so you think. I'm talking about prescription and over-the-counter sleep aids that are not benzodiazepines. There's a class of drugs called Z-drugs. Ambien is the most famous one. Lunesta, Sonata. Doctors started prescribing these because they thought they were safer than benzodiazepines. They're supposed to help you fall asleep without all the addiction risks. But here's what we've learned. These drugs don't give you natural sleep. They sedate you. There's a huge difference. Natural sleep has cycles. You go through light sleep, deep sleep, and REM sleep, the dreaming stage where your brain actually processes memories and cleans itself out. Ambien and Lunesta put you in a state that looks like sleep on the outside, but on the inside, your brain isn't doing its housekeeping. I want to tell you about a patient. We'll call her Margaret. Margaret was 68, a retired school teacher. She started taking Ambien because she had trouble falling asleep after her husband passed away. At first, it worked great. She'd take it, and within 30 minutes, she was out. But then her daughter started noticing things. Margaret would ask the same question 3 times in one conversation. She'd forget to pay bills. One time, she left the stove on overnight. The family thought she was losing it. When they finally looked at her medications, the Ambien stood out. They worked with her doctor to slowly taper off the medication, using a very slow, very careful protocol. Within a few months, Margaret's memory improved dramatically. She still had some trouble sleeping, but she was sharp again. Here's the science. A study in the British Medical Journal found that people over 65 who took Z drugs had a 40% increased risk of dementia compared to those who took nothing. But here's the even scarier part. In older adults, these drugs are associated with night wandering, falls, and hip fractures. And we all know that for a senior, a hip fracture can be a life-changing event. If you're using Ambien or Lunesta to sleep, I want you to ask yourself, is the sleep I'm getting worth the risk to my memory? And again, please don't stop these medications suddenly. I'll tell you why in a moment. So far, we've talked about allergy pills, anxiety meds, and sleep aids. But what if I told you the fourth medication on this list is one of the most commonly prescribed drugs in America, and most people taking it have no idea it's affecting their brain? Let's talk about a drug class that millions of seniors take every single day. We're talking about first-generation antihistamines for allergies. But there's a hidden category here. Actually, before we go there, I want to pause because this next one is so important, I don't want you to miss it. You might think, I don't take any of those. I don't take sleeping pills. I don't take anxiety meds. But stay with me, because this next medication is something you might have in your medicine cabinet for a completely different reason. And it's one of the worst offenders on this list. Let's talk about bladder control medications. This is a huge one, especially for women, but also for men with prostate issues. Drugs like oxybutynin, brand names Ditropan, Oxytrol, and tolterodine or Detrol. These are prescribed for overactive bladder, urgency, and incontinence. For many seniors, these medications are a lifeline. They allow them to go out to dinner, to travel, to live without fear of having an accident. But here's the catch. Bladder control medications are some of the most potent anticholinergic drugs on the market. Remember acetylcholine, the memory messenger? These drugs were designed to block acetylcholine, but not in the brain. They're supposed to block it in the bladder muscles to stop the spasms that cause urgency. But the problem is, these drugs aren't targeted enough. They cross into the brain. And in the brain, they block the very chemical you need to think clearly. A major study from the University of Michigan looked at thousands of older adults taking bladder medications. They found that people who took them for more than a year had a 30% higher risk of developing dementia. But here's what's really interesting. There are newer bladder medications, ones that are more targeted and don't cross the blood-brain barrier as easily. Drugs like mirabegron, Myrbetriq, and newer anticholinergics that are formulated to stay in the bladder. The problem? Many doctors still prescribe the older, cheaper, first-line medications because they've been around for decades. If you or a loved one is taking a bladder control medication, this is one of the most important things to ask your doctor. Is there a newer option that doesn't affect my brain? We've covered 4 medications, but the 5th one might be the most controversial, because this one is often a life-saving medication. I'm talking about corticosteroids. Not the creams or the inhalers, those are usually safe. I'm talking about oral corticosteroids. Pills like prednisone. Prednisone is prescribed for everything: severe asthma, rheumatoid arthritis, lupus, allergies, skin conditions. It's a powerful anti-inflammatory drug that works by suppressing your immune system. But here's what happens. Prednisone affects the part of your brain called the hippocampus. In high doses or over long periods, it actually shrinks the hippocampus. A study from the journal Neurology showed that people on long-term steroid therapy performed significantly worse on memory tests than people who weren't on the drugs. Their brains showed structural changes visible on MRI scans. Now here's the tough part. For someone with a serious autoimmune condition, prednisone might be absolutely necessary. It can be a miracle drug. But often, doctors prescribe it for conditions that could be managed with other medications. Or they keep people on it for years when it was only meant to be used for a few weeks. If you've been on prednisone for more than 3 months, you need to have a conversation with your doctor about whether it's still necessary and whether there's a steroid-sparing alternative. But, and this is critical, never, ever stop prednisone suddenly. Your body produces its own natural steroids, and when you take prednisone, your body stops making them. Stopping suddenly can cause a life-threatening adrenal crisis. This is one you must taper off under a doctor's supervision. Now here's something that very few people talk about. What if you're only taking 2 of these medications? Or 3? You might think, I only take a little bit of each, how bad can it be? This is where things get really serious. Let's say you take a low dose of a bladder medication, just a little bit, and you take a low dose of an allergy medication just during allergy season, and you take a low dose of something for sleep just a couple times a week. Individually, each one might seem fine, but together, they amplify each other. We call this the anticholinergic burden. It's like filling a bucket. Each medication adds a drop. By itself, a drop doesn't matter, but when the bucket gets full, it overflows. And that overflow looks like dementia. A study from the University of East Anglia looked at this exact thing. They found that people taking multiple anticholinergic drugs, even at low doses, had a 50% higher risk of developing mild cognitive impairment. That's the stage right before dementia. And the scary part? No one doctor might be managing all your prescriptions. Your allergist prescribes the antihistamine. Your urologist prescribes the bladder pill. Your primary care doctor prescribes the sleep aid. No one is looking at the full picture except you. That's why you need to be the quarterback of your own health. Okay, so now you know the 5 categories. But what do you actually do with this information? I want to give you a script. Literally, the words to say to your doctor. Because walking in and saying, I saw a video that said my meds are bad, might not get you the best response. Instead, you want to start a collaborative conversation. Here's exactly what to say. Doctor, I've been reading about something called anticholinergic medications and their effect on memory. I'm taking, list your medications. Could we review whether any of them fall into that category and whether there might be safer alternatives for someone my age? That's it. That's the magic sentence. Because here's the truth. Most doctors are good people who want to help, but they're busy. They have 15 minutes per appointment. They don't have time to review every medication's cognitive impact unless you bring it up. You bringing this up isn't being difficult. It's being informed. And for the medications where there isn't a direct substitute, like some blood pressure medications that also have mild anticholinergic effects, the conversation might be about lowering the dose or changing to a different class of blood pressure medicine that doesn't affect the brain. But here's the key. Don't demand. Don't accuse. Collaborate. Your doctor is your partner, and a good partner will appreciate that you're paying attention. Now I want to talk about what comes after that conversation, because getting off these medications, when appropriate, isn't always easy. Remember Margaret, the woman on Ambien? She didn't just stop. She worked with her doctor on a slow, step-by-step plan. For some medications, like benzodiazepines and Z-drugs, the withdrawal can be brutal if you do it too fast. You might experience anxiety, insomnia, heart palpitations. That's why a slow taper, sometimes over months, is the safest approach. And what do you replace them with? For sleep, we look at sleep hygiene. No screens an hour before bed. Keeping the bedroom cool and dark. Getting morning sunlight to reset your circadian rhythm. For anxiety, we look at therapy, mindfulness, and sometimes safer medications like SSRIs that don't affect acetylcholine. For allergies, we look at second-generation antihistamines like Claritin, Zyrtec, or Allegra, which don't cross the blood-brain barrier the way Benadryl does. For bladder issues, we look at newer medications, pelvic floor physical therapy, and sometimes even dietary changes. The point is, there are options. You're not stuck. If you take nothing else away from this video, remember this. Memory loss is not always dementia, and it's not always just aging. Sometimes it's a side effect, a hidden side effect of medications that were supposed to help you. For Frank, the retired engineer, his memory came back. For Margaret, the school teacher, her sharpness returned. Thousands of people every year experience this same turnaround, simply by having the right conversation with their doctor. But the only way that happens is if you know what to look for. So here's my challenge to you today. Take this video as your permission to be curious. Look at your medicine cabinet. Look at your loved one's medicine cabinet. Write down the names. And at your next appointment, ask the question. You might just save your memory or someone you love. If you found this information valuable, please hit that subscribe button. I create videos like this every week to help you navigate health and aging with confidence, not fear. And if you know someone who's on any of these medications, maybe a parent, a spouse, a friend, share this video with them. This is one of those things that could literally change the course of someone's life. Thank you for watching. Take care of yourself, and I'll see you in the next one.